This podcast is for informational purposes only and does not dispense medical advice. Always seek the advice of a physician or other qualified health providers if you have any questions regarding a medical condition. Never disregard professional medical advice or delay in seeking such advice because of something you have heard on this podcast. Welcome to a show that we like to call Prostate Cancer Real Talk. Did you know that in the U.S., 1 out of every 8 men will be diagnosed with prostate cancer during his lifetime? 1 out of 8. And black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. But hey, we're not here to quote statistics and tell you how tough prostate cancer can be. Rather, we are here to create a supportive community of survivors. A place where we can discuss the real-life coping methods from the perspective of a married couple who are living through it day by day. Our hosts, Elle and Shay. This is Prostate Cancer Real Talk. Today, we welcome Dr. Catherine Handy Marshall. Dr. Marshall is an assistant professor in the Department of Oncology at the Johns Hopkins University School of Medicine. Her areas of clinical expertise include internal medicine and oncology. Dr. Marshall received her MD and Master of Public Health degrees from Johns Hopkins University, where she also completed her residency and an oncology fellowship. Dr. Marshall's research interests include the relationship between cardiovascular disease and cancer, clinical trials in advanced prostate cancer, and genetics in prostate cancer. Today, we will focus on her work with the Promise Registry, a free genetic testing study that explores the role of genetics in prostate cancer. Ellen Shay, take it away.
Thank you very much, Dennis, for that great introduction. And welcome, Shay and Dr. Marshall. Greetings to both of you today. We're so happy to have you with us. So, Dr. Marshall, before we actually get into the meat of the discussion with regard to genetics and your affiliation with the Promise Registry, tell us a little bit more about your decision to go into medicine, and also how'd you get into this specific genre of genetics?
Hey, thanks so much for having me, Ellen Shay, and it's so nice to meet you guys, and it's so nice to be here today. I don't want to take up the whole episode. I can't go through the whole story because I don't, when I was a kid or even going through college and medical school, I didn't necessarily know that I was going to end up being a prostate cancer medical oncologist or researcher. But there were a number of family members that I had over, my lifetime that have died from cancer. And that certainly had a profound impact on me. And, I take that with me when I'm treating my patients, because I know how hard it is for families to go through this experience. And, my goal as a doctor and a researcher is to, try and not have that happen for other families.
Okay. So tell us a little bit about where you practice. I know you're at Johns Hopkins. Tell us a little bit about your selection to go there, because I know you went to school there as well.
Yeah, I am originally from New York and thought that I would always be in New York. But I came down here to visit Johns Hopkins as a medical, or I guess looking for medical schools. I met Levi Watkins, who's a very famous Black cardiothoracic surgeon down here, and he had a profound impact on me at the time, and it seemed like a really great place to train. Hopkins has I would say that this is really a fantastic place for training and really a commitment for education and training. And I loved it. And then I've lived in Baltimore the whole time I've been here, and I love Baltimore City. So I stayed. So now I'm here many years later. I stayed for all of my medical school and training, and now I'm on faculty.
The Promise Registry is an exciting new partner of Prostate Cancer Real Talk. Promise is a registry of prostate cancer patients who want to learn how their genetics can affect their treatment options. To learn more, visit prostatecancerpromise.org.
So we're going to get into the meat of the matter, so to speak. Can you talk to us a little bit about genetics and prostate cancer, and why is that relationship so important between the two?
Yeah, so this is something that's probably just been figured out, and we're still learning a lot about it over the past, I'd say, 5 to 10 years. So a lot of work has been done to figure out the heritability of cancer, meaning like what amount of cancer gets inherited, or are there things that are passed down from other generations to people that contribute to their risk of prostate cancer. And prostate cancer is actually one of the most heritable cancers, meaning that it has a very strong genetic component. And that's what puts a lot of people at risk for developing prostate cancer. So even if you think about like the genes that are most common that we see in prostate cancer, they're actually BRCA, which stands for breast cancer, because when women get it, it causes breast cancer. But when men get those gene mutations or changes in the DNA, they cause prostate cancer. So it's actually something that's pretty important for patients. It's important for families to know. And it's increasingly becoming important for treatments, because now some of these gene mutations even have treatments that target them. So it's really critical to the treatment and management of prostate cancer.
So let's talk about the importance of communicating the disease to family members. So one of the things that we have learned through our experience with this podcast, and also in talking to family members and friends and whatnot, many times when men, and particularly Black men in this particular case, are diagnosed with prostate cancer, it's somewhat of a cultural, I don't know the word that I want to use.
Taboo, or
It's a taboo.
Like say it, yeah.
Exactly. And so what that leads to is a lack of communication. Fathers don't necessarily talk to their sons about it. So for the guys that are listening, and also the family members, spouses, significant others, talk to us about the importance of communicating to family members and why this genetic predisposition is so important. It's not something that should be kept secret.
Yeah, and I'll add on that list of people to communicate to is doctors, because and just I'm going to speak a little bit about prostate cancer sort of more generally. So there is a screening test, a PSA, or prostate specific antigen, and when to start getting the screening test, the PSA testing, what to do with those results, and other testing that you may need depends a lot on family history. And you're totally right that people don't necessarily talk about prostate cancer a lot, or necessarily talk about their symptoms a lot. And you should, I'm a doctor, so I, probably have more comfort than the average person per se with talking about a lot of symptoms. But people should definitely feel comfortable talking to their doctor about some of the symptoms that they may not necessarily want to talk to their family members about, which can include like erectile dysfunction, blood in the urine, changes in your urinary stream, even things like constipation. Because those can all be important signs to think about, like other testing that people may need. The other thing is that with family history, especially, that plays an important role into what screening or monitoring that people need to have and when that should start. And the last part about that, in particular for African-American families and men in particular, a lot of the genetic testing studies and what we know about genetic testing and the genes that are associated with prostate cancer, and really cancers across the board, were done in populations of European ancestry. So there are families like mine that have a lot of cancer in the family, and people come to me in clinic and they're like, I have all of this cancer in my family. I think that there's a gene or something that I probably inherited. And we do the testing, and it sometimes comes back negative. And what I tell them, and what I've told my family members too, is that we have not even sort of scratched the surface of everything that we need to know about prostate cancer and about genetics of prostate cancer. And that's because a lot of people have not yet been included in these studies. So we still have so much to learn. And even when, it's thought that like, oh, well, this family does not have a known genetic mutation, that's just what's known today. And if we contribute to more research, and as we get a better understanding, there may be different things that we learn in the future about the importance of family history and genetic testing and genes that are associated with prostate cancer.
Just a reminder, to ensure that you stay up to date on the latest episodes from Prostate Cancer Real Talk, don't forget to hit that subscribe and like button.
I know that there are a lot of studies and research going on. Can you talk to us a little bit about some of the current progress that's been made or being made in the study of prostate cancer?
Yeah, so there are new risk genes that have been identified to show, to say like these are the genes that are associated with an increased risk of prostate cancer. There's more research that's going on about, okay, well, if you have certain gene mutations, this is what your screening should look like versus other gene mutations or no gene mutations, and what your screening should look like. There are new treatments. Like I said, there are some already that are FDA approved, targeting specifically the more common gene mutations that we see in prostate cancer that I mentioned before, the BRCA1 and BRCA2 gene mutations. And there are more that are being developed for some of these other gene mutations that are not as common as the BRCA1 and 2 mutations, but still pretty prevalent in prostate cancer. So it really spans the whole breadth of what we know, from all the way from screening and even pre-diagnosis of prostate cancer to treatment of even advanced disease. And the genetics of the disease plays a role in all aspects.
So there's a phrase that you've used several times, and I'd like for you to explain it, elaborate on it a little bit more. So when you say gene mutation, all right, what is that?
Yeah. So everybody has DNA. Those are sort of the building blocks of the cells and of our bodies. And genes are specific like segments of our DNA that turn into like different proteins, and us basically turn into different organs. There are certain changes in the DNA, and that's what we call mutations. Sometimes those are normal, and sometimes those can cause problems downstream with what the DNA is supposed to make. So those mutations are then what we think, because those are changes that have sort of functional consequences, and those are things that we think lead to cancer. And those are things that we think sometimes can be exploited or used with the new therapies.
Okay. Let's transition into a more specific conversation around the Promise Registry. Okay. I'd like for you to talk a little bit about what it is. And I know one of the challenges that they've had is getting Black men to participate at a higher rate. So can you talk to us about the Promise Registry and why it is important, particularly to have a control group, so to speak, why that's important in the area of prostate cancer research and the work that the Promise Registry is doing?
Yeah, so the Promise Registry is an observational study. So there are no treatments associated with it. It's really just people signing up and then getting genetic testing done, and then being followed to see what sort of what happens with their prostate cancer and what sort of treatments and outcomes people have as they go along. So it's for people with prostate cancer. You can have any stage of the disease. So if you've just been diagnosed, or if you have advanced disease, or if you've had treatment for localized disease many years ago, like, you can still participate. And it's also for people in the United States. You have to be adults, 18 years of age or older, but younger people don't really get prostate cancer, so that shouldn't impact us. But for adults with prostate cancer in the United States. And what the study does is it sends you a testing kit for genetic testing. That's a saliva kit. So you give a saliva sample, and then you get those results back directly. So the results go back to, you as the patient signing up for the registry. And then you contribute your information as you go along, and you get information back about the updates and progress in prostate cancer genetics going along. The genetic testing that comes back, so we estimate, depending on the stage of disease, probably anywhere between 5 to 10% of people will have one of these gene mutations. But we may, through the course of it, also learn, like I mentioned before, about new risk genes for prostate cancer. But that's what it is. So, but it's an observational study that's longitudinal, that does genetic testing for patients with prostate cancer and follows them over time to see what treatments and what happens with their disease over time.
There's a reluctance in many times for Black men and the Black community in general, and clinical trials and research. Can you tell us why that is so important for us as a Black community to participate in these research studies and clinical trials and things of this nature, why should we participate and why is it so important?
Yeah. So like you mentioned, there are a lot of reasons historically, like why people do not, people from the Black community do not want to be involved in clinical trials or clinical research in general. And that's partially, at least, because there have been horrible wrongs done to the Black community in this, under the guise of clinical research. So I definitely cannot discount that and don't want to, because there have been horrible things that have been done. And that has led to lingering, impacts and decline in participation or smaller participation or less participation amongst minority communities, as a result of that. So that, at my institution included. So that has definitely happened. But on the flip side, there has been tremendous progress that's been made in cancer, especially, and other fields, but, in my fields of oncology. And that has been through clinical trials. So there have definitely been wrongs done, and those have been concentrated in Black communities and minority communities. But there's been tremendous progress, and there's a continued investment in progress in terms of treatment, diagnostic testing, in prostate cancer and other cancers. And it's critically important for our learning and our future direction. And, with everybody who's trying to work to really cure or end suffering from cancer. And we want everybody to be a part of that. And we really need the benefits to be reflective of the patients and the people who are burdened by the disease.
I have a question. So we normally hear the words like research study, clinical trial, and in this we're hearing observational study. So tell me the difference.
So typically when people think of clinical trials, it's testing some new drug or new vaccine, or something is being done to you, like you're either being asked to take some sort of treatment. This is an observational study, meaning that the researchers are sort of just observing what happens. So there's no intervention where they're going to say you do this or don't do this. It's just collecting information about you and about your treatment pattern. But your doctor, you and your doctor are in charge of the treatments that you get. So there are no sort of new treatments that are directed towards this. As you will get information in general about prostate cancer treatments and research that's going on as sort of education that goes back to you from what has been learned in the field. But this study doesn't give anybody sort of treatments associated with it.
Okay. So I have probably over 100 men in my family. And over the weekend, I was talking to about 5 of them to participate in the Promise Registry. So I want to make sure I was doing it correctly. So they have not been diagnosed with prostate cancer, and there's not a history that we know of in the family of prostate cancer. So are these guys great candidates to participate or to sign up for the Promise Registry?
So no. The Promise Registry is really for people who have been diagnosed with prostate cancer. Yeah. So if they have not been diagnosed with prostate cancer, then this would not be for them.
Okay. Because my one uncle, we think he might have some issues, but he's like, well, what are they going to do with my information? He's this military guy of 40 years, and he had all these questions or whatever. And I said, his PSA, he said, was elevated, but he has not been diagnosed with prostate cancer. So I just wanted to make sure. So the Promise Registry is simply for people that have already been diagnosed with prostate cancer. Yep. Okay. Gotcha. Okay.
Are there any other eligibility requirements in order to participate in the Promise Registry study?
Yes. So you have to have prostate cancer. You have to be 18 years of age or older. You have to live in the U.S. or its territories. And then you get the genetic testing. And then if you have a genetic mutation, then you will be followed along in the prostate cancer registry, in the Promise Registry.
And I just want to comment that I participated myself. So for people who are wondering, how extensive is it? How easy is it? It's very easy. I went online, and we also are going to be giving the information on how to register. There is an announcement within this broadcast that will direct people on how to register. And so I went online and I registered, and I received my kit in the mail within a few days, I think about a week or so. And it's very simple to do. You open it up, you give your saliva sample. It's not a cotton swab or anything like that. This isn't very delicate here, but you spit into this tube to a certain level. It's not a lot, but you have to spit into this tube. It collects your saliva, and when you seal it, it combines with this mixture that preserves it. You package it up per the instructions, and you mail it back in. So I'm currently waiting on my results, but I did want to just let people know how easy it is, and I'm really interested in seeing what my results are.
I know this, and we hear this all the time. Even when we talk about like clinical trials or whatever, the listeners always say to us, "How secure is my data?" Yeah, that is huge, and especially in the Black community, that is so huge. Like there's that part of the hesitation with guys wanting to participate in any kind of study. So how secure is the data once they sign up for the Promise Registry and, as Elle said, and spit into the tube?
Yeah, so I get that question a lot in clinic too. So these data that are generated for research are only used by the research team, and this is like a national study. It's supported by a nonprofit whose mission is to advance precision medicine and expand access to clinical trials. So the research is actually, once you submit your information on the back end of it, it gets anonymized. So the data doesn't get can't be traced back to you. And all of the databases are secure. So these data are not, people in clinic usually ask me, like, is it sold to other people? It is not. It's not sold to any other companies. People also ask me, like, if it'll tell you any information about like ancestry or other things that you can do genetic testing for. And it also does not do that. Mm-hmm. This is specifically like for prostate cancer research. And that's what we're looking for.
Where do people go to register?
Yeah, so the website to register is prostatecancerpromise.org. You can go online there, and there's more information, and you can register there. You fill out a few questions online just to confirm your eligibility. There's an informed consent process, which will give you a lot more information too. And then, like you mentioned, once you're signed up and confirmed to be eligible, then the kit gets mailed directly to your house too. So you don't have to, you can participate from anywhere. It's not like you have to go into an office somewhere to participate. And then you can do everything from home.
So what's the follow-up now? I'm not the typical participant, I don't think, because I've already been diagnosed. I've already been treated surgically. My follow-up PSA tests have come back in. But for a person that's been diagnosed and they want to participate, what should they expect to receive back? And how long is the participation go on?
Yeah, so usually after you send your saliva specimen in, it usually takes a couple weeks, about 1 to 2 weeks, for you to get the results back. Again, the results come back to you. The genetic testing results, I always explain to people, there are 3 things that can happen, or 3 results that you can get back. It can be negative, and that means that there are no currently known mutations that we found in any of these genes that would predispose you to cancer. There's no specific follow-up per se that you need to do, but you get information back, just educational information back periodically from the Promise Registry. And then the alternative result that you can have is a positive test. And that means that there was a genetic mutation that was found in your saliva. And that means that you're at an increased risk of prostate cancer. Sometimes actually that means that you're at an increased risk of other cancers. So in that scenario, you should have follow-up with a genetic counselor to see what other follow-up you may need. And that happens through the Prostate Cancer Registry. And then there's an in-between, which is sort of a gray category. These are called variants of uncertain significance, or VUSs. And that means we don't exactly know. We found changes in the DNA, but we don't exactly know if those are associated with an increased risk of cancer. And in that scenario, we also recommend genetic counseling and follow-up, and that is also provided through the Promise Registry.
Hey guys, this is Elle. Did you know that during the treatment of prostate cancer, our genes may be our most powerful tool? That's why the Promise Registry was formed, and that's why I joined. To learn more, go to prostatecancerpromise.org. That's prostatecancerpromise.org.
Okay, so Al said that he doesn't think he's the typical candidate. So is that true? Because even though he's had this surgery and everything, wouldn't like that test maybe pick up and say, hey, this is why you had it? There was something about your genes that led you to have prostate cancer, basically. So is it true when he says he doesn't think he's the typical candidate?
Well, for the Promise Registry, we want everybody. And like I said, we're still learning a lot. So, I don't want to necessarily give an idea that there should be a typical, because I think part of it, too, is that we really need to redefine, like, what is a typical participant, right?
Right.
We want to really expand that. And there's still a lot to learn. So in the sense of typical, meaning that you've had a diagnosis of prostate cancer, we do want you to participate. And, this is not for only people who have very, very advanced disease. Exactly. It's for everybody with prostate cancer, because there's a lot that we have to learn. And, we don't, know everything about sort of the natural history, too, of how these different, tumors with the different mutations sort of evolve over time. So it's for anybody. Yeah. So if you've had prostate cancer, then you are the typical patient, and we want you to be the typical patient, and we want you to participate.
Yeah, I just wanted to clear that up to the listeners, because we have a lot of listeners that have already, gone through radiation or surgery, and I don't want them to think like, hey, well, I've had radiation, I've had surgery already, so I don't need to, register.
That's exactly right.
Yeah, so we want everybody to register. If you had prostate cancer, if you have prostate cancer, we need you to register with the Promise Registry.
Yep, that's exactly right. Okay. Even if you've been cured or prostate is out, no PSA, we still want you to register.
Thank you for correcting me, Shay. She does that a lot.
That's what lives are for, right?
Yeah,
So more generically speaking, Dr. Marshall, we know that prostate cancer is the second leading cause of cancer in the U.S. for men in general, after skin cancer. And in preparing for this discussion, I came across the statistic. We've been doing this for a while, but I was even shocked to see this. We always say that Black men are 50% more likely to get prostate cancer than the general population, and 2 times more likely to die from it. But I saw a number that stood out in my mind, and it said that 76% of African-American men or 76% more susceptible to prostate cancer. That's a big number. Can you talk to us a little bit about the susceptibility? And we've talked about this on some other shows, but I'd like to get your perspective. Why are Black men so susceptible to prostate cancer?
Yeah, so there are a lot of different factors that increase people's risk of prostate cancer. And then the disparities in prostate cancer in terms of diagnosis and treatment and outcomes are also complex. So there are a lot of reasons, and I don't know that we know all of them. I think it's a multifactorial, and there are a lot of different reasons and a lot of different contributing factors to, in particular, the disparities in prostate cancer. And I think that those sort of collectively lead to these disparities. And we, I think, as a community and as a field of researchers, have not done a great job of targeting the disparities in prostate cancer diagnosis and treatment that have led to these disparate outcomes between populations. I hope, and I think that is starting to change now as we sort of focus in on disparities and how we can fix the disparities in prostate cancer. But there are a lot of factors, I think, including genetics, that I don't think we fully understand for increased risk of prostate cancer.
One of the questions that we did not ask so far is, does it cost anything to participate in the Promise Registry?
Yeah, good question. It's totally free. You don't have to worry about copays and such. It's totally free for patients.
So if a person just goes to the address again, please give it again.
Yep, prostatecancerpromise.org.
Okay, you go there and you register, you're going to get a kit in the mail regardless.
Yep. Okay. If you're eligible to participate, you get a kit in the mail. There's no credit card number that needs to be given. There's no insurance information that needs to be given. So it's totally free for you. And then the follow-up, the genetic counseling appointment that I mentioned, if you have one of these alterations, is free. And then, updates afterwards are free.
I will say that they do ask you a battery of medical questions, like information about some of your family history and things of that nature. So it's not like you just go in there and check one box and they send it to you. They do ask you a series of questions. And so for someone who sees these questions, Dr. Marshall, why should they not be concerned about answering those questions?
So similar to the genetic test results, all this information is, again, just being used to learn more about the genetics of prostate cancer and learn more about the impact that those genetics have on outcomes of prostate cancer. So all of that information, even when you get asked like follow-up questions about how you're doing, what's going on with your prostate cancer, has it come back, have you started new treatment for it? All of that gets, anonymized and sort of secured together with the genetic data. So that's all, these what we call clinical outcomes, or, what's happening to you as you go forward with the prostate cancer journey, is all secure, and so that we can learn about what happens to the disease.
Now, is there a certain gene that's going to be tested when they send the kit back?
Yeah, so there is a panel of genes. Again, these are genes that we know to be associated so far with prostate cancer. So that's what you're being tested for. So that's why I mentioned too before, the panel of genes that we're testing is specific for prostate cancer, and does not sort of extend beyond prostate cancer to like other diseases.
So the results come back to the individual.
Mm-hmm.
So will there be like instructions like to tell, like, for example, like if the patient comes back like positive, like, will there be instructions like, well, they could take it to their primary or take it to their doctor, like, hey, I did this study, or, participated in this study, and these are my results. And here, how do we go forward? What do I need to do?
Yeah.
If the patient have come back, the results have come back positive.
Yeah. So if the results come back positive, you can definitely input your doctor's information into the registry too, so that the results do also get sent to your doctor. But if you do have positive results, you do also have access to a genetic counselor through the Promise Registry. And that genetic counselor will also walk you through the implications and what it means to have a positive result. And if there's any follow-up, like sometimes for additional cancer screening that you may need to have for other cancers besides prostate cancer. So that genetic counseling will happen or will be offered through the Promise Registry.
Oh, that's awesome. So everybody needs to sign up.
And on that point, how many participants are needed for this study?
So we're hoping to recruit about 5,000 men to the Promise Registry. We estimate that probably about 10% of those men will have one of these mutations that we're looking for. So that'll be about 500 men with the mutations. But overall, we're thinking we'll need about 5,000 men to get to that number of 500 patients with mutations.
Don't forget to subscribe to our YouTube channel and like this video to keep seeing more content like this from us. It will also benefit YouTube's algorithm, helping to introduce our content to others who may need it most.
I'm curious, how or who's behind like the Promise Registry, because everything is free, so I'm like, okay, all this is free. So do we have like some angels that's like just trying to, that's trying to help everyone out here? Like, who's sponsoring, who's behind the Promise Registry?
Yeah. So you're totally right. So it's free to patients, but it's not free, right? So it's led by two of my colleagues, Dr. Heather Chang, she's out at the University of Washington, and then one of my colleagues here at Hopkins, Dr. Channing Poller. The funding and support is provided by a nonprofit that's called Advancing Cancer Treatment. And that nonprofit organization's mission is to advance precision medicine and expand access to clinical trials. And that's what we're hoping to do by, identifying people who have these genetic alteration or mutations in their genes. So that's who's providing the financial support for it.
Oh, God bless them. Well, they are angels.
So as we kind of conclude, I have 3 words that I wrote down. I'm big on writing down 3 words.
Yes, he is.
So, these 3 words kind of encapsulate the whole conversation. These 3 words are free, secure, and helpful. Okay. Dr. Marshall, can you kind of summarize the Promise Registry study, why it's so important for men in general to participate, but can you kind of give us a parting pep talk before we get out into the field?
Yes. So the prostate cancer registry, that's called Promise. You can go to prostatecancerpromise.org to sign up. It's a free, secure genetic testing observational study for men with prostate cancer. And the goal of this study or registry is to learn more about the genetics of prostate cancer and how that impacts outcomes for men with prostate cancer. So that's what we're hoping to do. We need everybody to participate, and we really want it to be representative of the people who have prostate cancer. So it's critically important that anybody with prostate cancer participate so that we can learn more about the genetics of prostate cancer.
So I want the listeners to understand there's no comparison to register to the Promise Registry and like, what is it, 23andMe or something?
No.
There's no, yeah, because you know what, because a lot of people will think like, oh my God, like this is gonna like track down everyone that I'm connected, No. Can you make sure, like, let's tell the listeners there's no comparison.
There's no comparison to anything that you can do, any sort of genetic or anything genetic that you heard about that you can buy sort of over the counter or at a pharmacy. So there's the genetic testing that's like things like 23andMe or like Ancestry. That is totally different and separate from what we're trying to do. The testing that you would get as part of this registry is for cancer and for prostate cancer. So is totally different from those.
Okay. And one last thing I want to ask about that. Do you have like any examples, because we want to give, the listeners hope like, hey, this is why I should do this. This is why I should register. Do you have like any examples of like maybe a person that has participated and, the outcome and how it made a difference perhaps in their life? I know you can't, be specific with it.
Well, so we estimate again about 5 to 10% of men with prostate cancer will have one of these gene mutations. Mm-hmm. And these are gene mutations that sometimes impact your prostate cancer treatment, mm-hmm. your prostate cancer prognosis, impact your risk of other cancers, and will have implications for your family members. So certainly will, potentially be something that you want to share with family members so that they can be informed about their risk of cancer as well.
And on this privacy issue that Shay just highlighted with this 23andMe and whatnot, to show you how real this is, Shay put me through a battery of questions. When I decided to participate in the Promise Registry,
I was like, "Oh no!"
I was like, "Where's this information going? And who's going to see it? And what?" I won't go into the details, but just say that it's a real concern, and we experienced it ourselves. Yes. But after educating ourselves and understanding the process a little bit better, we understood that it's completely safe and personal and private. You use the term, Dr. Marshall, randomized.
Anonymous. So that means that your personal information, so like your data when it's stored is not stored, connected to L, it's connected to, a number, it doesn't come back to you.
So Dr. Marshall, so I'm really curious. Have you seen any examples of where understanding a patient's genetics may have impacted their treatment options?
Yes, absolutely. So there are already FDA-approved drugs. Specifically in prostate cancer, there are drugs called PARP inhibitors, and those are approved for men who have some of these genetic mutations that we're looking for in the Promise Registry. There are more drugs that are being studied in the context of clinical trials. So in addition to potentially learning about standard of care treatment options that may be available, understanding your genetic test results and understanding and having genetic testing may also open up the possibility of additional therapeutic clinical trials or new treatments that are targeting specific gene mutations.
Okay. So what about if people that have already had genetic testing, if you've already had that done, should you still participate in the Promise Registry.
So if you've had genetic testing done already and you know that you have one of these gene mutations or any gene mutation that's been associated with cancer, we still want you to participate because we want to know what happens long term, and we're following outcomes of prostate cancer and men who have prostate cancer with these various mutations. So if you know that you have one of these mutations already because you've been tested, please still also sign up. We will ask you to do the genetic testing so that we can confirm that mutation, but we would still love for you to participate.
Okay.
Awesome. Okay, and Dr. Marshall, can you tell the listeners one last time where they can go and register?
ProstateCancerPromise.org.
Dr. Marshall, thank you so much for your time and your really, really detailed explanation of genetics around prostate cancer, and specifically about the Promise Registry and this great study that's going on, and explaining to us why we should really participate in this. Do you have any parting words you'd like to share?
No, thank you guys so much. And thank you all for everything that you're doing. And thanks for having me on today to talk about this. And I'd love to come back another time.
We're going to take you up on that.
Yes,
Thank you.
we definitely are.
All right, take care.
Thank you very much. Thanks for being on the podcast.
You're welcome, guys.
To find out more information on the guest you just heard or previous guests and a list of Prostate Cancer Real Talk episodes, visit our website, prostatecancerrealtalk.com. And if you have a question, comment, or if you would like to share your story, send Elle and Shay an email, ellandshay@prostatecancerrealtalk.com. That's LEL and Shay, SHAY, at prostatecancerrealtalk.com.